Thank you so much. I'm delighted to be here. I am going to start by saying I was fortunate in December to be invited by the IFHA to speak on a similar topic relating to horse welfare. And I was introduced by Chris Riggs, who you'll hear from shortly, with the explanation that America had previously been a pariah when it came to horse racing, horse welfare in horse racing. And to be honest, I had not realized it was that bad, and perhaps I should have consulted Mr. Riggs before taking the job. But the story that I'm going to tell today is really the story of how 4 years ago, the United States Congress stepped in and created the Horse Racing Integrity and Safety Authority, which is the organization that I run that oversees safety and integrity in American horse racing. And when it did that, it was February, actually exactly 4 years ago this week, that I was hired as the first employee of HISA. And blank piece of paper, we had a law, and I didn't even have a laptop yet. And over 4 years, the extraordinary team that we built has really made a significant, I would say, impact on horse welfare in the U.S. and certainly on horse fatalities. Racing has never been safer in the U.S. than it is today. I'm very proud of that, and I really want to talk about how we built that by having a horse-centric approach, really relying on data and technology. So I'm going to start by asking for the lovely gentleman up there to play the video, please.
For owners, for trainers, total visibility into every horse, right here, right now. Veterinarians upload treatment data in real time, accurate, complete, and ready when it matters. One powerful suite of apps, reporting from the barn, managing access on the backside, all in one system. Any device, anywhere, anytime. Online or offline, nothing slows the flow of critical information. From a layoff to the starting gate, full transparency every step of the way. Stronger tracks, higher standards, safer competition for horses and people alike. Data-driven risk assessment before the horses ever step on the track. Higher risk entries flagged, smarter decisions made. One horse, one record, the complete story, instantly. Races, injuries, workouts, layoffs, everything that matters at your fingertips. Risk insights integrated, visible, and actionable. Turning data into insight. Insight into prevention. An ecosystem of care, a safer sport, built for today and for generations to come.
So yesterday you heard from Bill Karstanjian, who's the CEO of Churchill Downs, the Kentucky Derby, and it was a fabulous presentation. Obviously the Kentucky Derby is an extraordinary event. The way that we see our job at HISA is to make sure that nobody's talking about safety, that they're watching the incredible races in the US, that they're enjoying them, and all of that is in the background because it's taken for granted that the horses are well cared for, the horses are safe, and it doesn't need to be discussed. So I spoke a little bit already about the fact that we were created at the end of 2020, we were signed into law. We were created, we launched our first program in July of 2022, which was the Racetrack Safety Program, and then the Anti-Doping and Medication Control Program was launched in May of 23. Both these programs working together have made a very significant impact on racing in the US. this is a slide I wanted to spend a few minutes on, and it really sort of captures what you just saw in the video. We're fortunate at HISA, because we are created by federal law, to have a mandate where information is required to be provided to us. So we have to receive diagnostics, treatments, everything related to what a horse is doing in its training and care leading up to and during the races. So by taking all of this information, as I said, using a horse-centric approach and having it in one place is a tremendous advantage for us. We have about 6 million veterinary records at this point in time over the last 4 years. We have about 90,000 horses who are actually followed and contain information in our system. And by using that information, we're obviously able to do a lot in terms of understanding what's creating the criteria, the factors that are causing risks for horses. This is just really a snapshot of how the progress has been over time with regards to equine fatalities, racing fatalities in the US. Our view at HISA is that we have to be incredibly transparent, that everything really starts with transparency. So we currently make public on a quarterly basis, by state, by racetrack, what the equine racing fatalities are. So our stakeholders in the US, and actually anybody really, can see on a quarterly basis, on an annual basis. We do 18 months, 24 months, just so everybody can understand kind of where we're going. It's not a direct, straight line, but it's been consistently much better than it was pre-HISA. We have in our database, and something that I rely on very significantly, is we have in real time all of the racetracks in the US in one place with all of the fatalities essentially inserted within 24 hours of the fatality happening. We have it for both racing and training. So, we're a big country. HISA oversees 41 racetracks. So I'm able to look at this every morning and see, is there anything that I need to be concerned about? Do we need to deploy a team to any particular location in the US to see what's going on, to see if there's a problem? And that really wasn't available before. So being able to have that real-time information and consult it has been a huge advantage and allowed us to be reactive very quickly. Same thing as I was saying earlier, we now share training fatality data on a quarterly basis as well. Obviously, if a horse dies in racing or training, it's equally significant to us, and we have just as much motivation to prevent it. And so having to collect that data and follow it is really important if we want to make a genuine impact on horse welfare in the U.S. One of the things I just wanted to point out is the numbers that we use, the ratio, obviously for racing-related fatalities, I think everybody probably knows we use starts as the denominator. For training, we use workouts, but actually, we consider a fatality from any training activity to be a training fatality. So this number is actually somewhat conservative because there are gallops, et cetera, that are not being counted that may have resulted in the fatality, and we're still counting the fatality. We're now kind of getting into an era where we're looking a lot more closely at the different causes of equine fatalities. Obviously, musculoskeletal is always going to be, the largest percentage, but we have really focused on sudden death in the past year because sudden death is about 16% of our fatalities in America, and really nobody knows very much about it. It's quite a black box. And so we've been fortunate to lead a working group through HISA with some renowned experts to try to understand what's happening. And we've got a current study going on where horses are wearing essentially wearables. And so if they do have a heart event or a cardiac event, our experts can follow it quickly and try to learn something. And they have learned, they have been learning some interesting new things that I will not explain because I do not have the expertise, but will definitely be released to the public soon. We count everything, right? I mean, we're so lucky that this data is mandatory, so we try to track anything that we can possibly track. So we also, let me just take a step back. In order to be able to race in the US, you have to register with HISA. The person, the horse, the jockey, when I said the trainer, the horse, the jockey, the owner, you have to all be in the system, or else the horse is not allowed to race on any given day. And so this breaks down essentially who we have registered in our system and what the numbers look like. That also allows us to track trends. So, you know, a lot of times I hear in America that we're sort of chasing owners away by being too onerous with our rules. Actually, our owner registrations have been increasing per quarter in the last 3 quarters. So it's very helpful to be able to obviously go back and look at the data. I think I mentioned earlier we have about 6 million veterinary records. We get about 7,000 a day. We fortunately have fantastic IT people who are able to take in that data and make sure that it goes to the right places, so that those of us who are kind of on the ground can be versatile, can react to whatever information that we're learning to be more protective of our horses. HISA Horse Insight is a new product that we have that we're really excited about. It's primarily being used right now by our regulatory veterinarians, primarily in the pre-race context. What we're able to do is have a snapshot of every single horse, all 90,000 in our system, where you can look in one place at essentially their veterinary records, their racing history, any layoffs, like any significant events in the horse's record in the horse's last, well, I guess since HISA launched, so in the last 4 years. And that has been, I think, a tremendous time saver for our regulatory veterinarians, and also has allowed them to be a lot more effective pre-race. There are a number of racetracks in the U.S. where there are so many horses that need to be looked at pre-race, that this also allows the regulatory veterinarians in those sort of smaller jurisdictions to focus on the horses that have the highest concerns or the highest risk profile. And HISA Check is our risk model. What we do with HISA Check is we have about 44, I think we're actually up to like 98 now, risk factors that we look at, weighted differently based on AI and machine learning, to determine the risk profile of every horse that races every day. So this runs against every race card across the US every single day, and it assigns a number to every horse. The number is somewhere from 0 to 20. And again, the regulatory veterinarians can look at those numbers, and they tend to use it as a guide to help them in their pre-race examinations. And actually, you know, there was a time when I was wondering, you know, how impactful and how helpful it was to our regulatory veterinarians. Recently, well, in the last like 6 months or so, if they don't receive it by 8 a.m., we start getting a ton of calls. So we realize that this is actually, you know, quite a helpful tool, and we're going to continue to work on it to make it more helpful and ultimately to be able to release it to more stakeholders. This is really just a snapshot of how HISA Check works with the various risk factors, and how it gets essentially integrated into our analysis and into our rulemaking. So once we have, you know, we've got the data collection, we've got the data, you know, we watch the trends to make sure that there's nothing that we need to react to, address. And the next step for us is equine health advisories. It's a step before rulemaking. It's basically a place where we feel like we have enough information about something that we should share it with our stakeholders. They should know what we found, but not enough to actually create a rule yet. It's kind of a precursor to rulemaking. So this was something that Dr. Jennifer Durenberger, who many of you may know, who oversees our equine safety and welfare program day to day, created this concept, and it's been very helpful because we've been able to, again, like, you know, we exist to serve the industry. So when we have information, we want to be able to share it as quickly as possible. So we do send out these equine health advisories whenever our veterinary team feels like there's enough information, enough evidence that it's worthy of sharing, even if we're not quite at the rulemaking stage yet. That was all related to our racetrack safety program, although we do incorporate anti-doping violations into HISA Check and into HISA Horse Insight. But just a little bit about our anti-doping program. The way that it works under HISA is we are required by law to outsource the day-to-day management of the anti-doping program to an independent agency. So that agency is called the Horse Racing Integrity and Welfare Unit, we obviously work hand in hand with them. HISA creates the rules that they have to implement, but in order to have some distance from the day-to-day management of cases, they operate independently in that regard. They also are using our template, which I probably should have said is powered by Palantir, in order to also really create the most effective race testing plan, right? One of the things we say in the US is that a post-race test tends to be more of an IQ test, and the important kind of information comes from investigations and out of competition testing. And the data that they essentially review daily helps them to do a better job at out of competition testing in order to target essentially the right horses. And this is really explaining how it's so important on the anti-doping side that we look at all of the various areas that we work in sort of holistically and collectively, so that we can truly understand, what we need to do to be impactful. We have so many tools available to us, and we are trying to deploy them as effectively as possible. We also, the investigation side has been significantly augmented under HISA. We have a fantastic team of investigators. Most of them are retired FBI agents, and they get something like 1,000 tips a month, many of which are actually helpful and advance their investigations. And we use a program called Real Response, where stakeholders can actually text anonymously any sort of tip or information that they want to share with the investigators. And it says here that 84.5% of the tips that we receive warrant a follow-up investigation, which is quite a high number. Now, I love the last presentation on aftercare, because I'm definitely a believer that aftercare is so important to what we do, and without sort of a long-term plan for horses, it's very hard to be able to defend the sort of social license of the sport. At HISA, the authority that we were given was from a horse's first official workout till it retires. So we don't have authority over rulemaking kind of in the aftercare space. But what we've done over the last 4 years, using all of the data that we have, is trying to determine where the gaps are in the system, like where can we actually be helpful. And one of the things that we realized is that it was a very significant burden on our aftercare organizations to take on horses that had an injury. Even if the long-term prognosis for the injury was very good, like a condylar fracture or a sesamoid or whatever, it was still hard for them to be able to place a horse that still needed surgery or care, etc. So we recently launched the HISA Equine Recovery Foundation. It's managed entirely separately. It's completely independent from HISA. It's a 501c3 organization with an independent board. And basically the mandate is to identify horses on track that have an injury that can be healed, an injury that has a very good prognosis for recovery, and essentially fund that recovery, fund that surgery, so that when the horse is ready to go into aftercare, they're an attractive and essentially it's much easier to place them. It's been a really phenomenal reaction in the US to launching this. We have a lot of veterinarians who've agreed to provide services either for free or low cost. We've got van companies who are willing to transport horses for no cost because of all the work that they do and what they get from the industry. So this is a very new program. This is essentially how we look at eligibility. It's obviously complicated, and decision has to be made very quickly on track. And so our HISA vets are in touch with the veterinarians at the race courses, and they've agreed on essentially a plan on how we approach the analysis of each case. Whether euthanization is more humane or whether or not there's really a path to pasture soundness. Okay, and this is the first horse that we took under our program, and the horse is doing great. So thank you all so much, and I am going to turn over now, just in time.